I want to welcome you to this class, PSY 203, the practice of counseling. This is a class that is aimed to help you examine the key concepts in the counseling practice and other related fields. But probably before getting there, I would want to introduce myself. I am the Reverend Dr. James Mbogwa. I am your counselor. I am also your lecturer in this department and also in this unit in the Africa Nazarene University. Some of you have expressed the desire for us to meet at different times in the evening, and some of you have expressed that they may not be available during those times. So in the interest of all of us, I have decided that I'll be recording these videos so that you can watch them and be conversant with what we want to learn in this class. Counseling, as we may have known from the other units, is a helping profession, and in this course, we will aim to give a distinction between counseling from all other helping professions and practices. This course explains the counseling relationship, examines the counseling process and the strategies of integrating the skills and the processes. It demonstrates the application of Egan's developmental model in therapeutic encounter with clients. We will also aim to equip you with abilities to apply divergent skills, strategies, and models in the counseling process. At this very early juncture, I would want to say that it is good that we look at some of the units we have undertaken in the past in this course, because this is a developmental course. It proceeds from others you have done, and you'll be hearing me mention terms you have come across in the past. The purpose of this course is to expose you to basic counseling skills practice through micro practice and real client experience. And as you may have noticed in our project, the very first assignment for this unit, I am giving you work to relate with real live clients. So you'll be expected to get a client, you'll be expected to practice, and that will be what I will be examining as part of your project. We realize that this is a very short term, and therefore our work, our participation is required, active participation, and therefore for you to learn, for you to move on, we will require your active participation in this. By the time we are through, and I hope through your participation, through reading forward, through interacting even on the WhatsApp chat, by the time we are through, we'll be expected that you shall be able to define relevant terms in counseling practice, describe a healthy counseling relationship, define counseling skills, explain the functions of each counseling skill, describe the counseling process right from stage 1 all the way, explain the goals of therapy using different models, but for this class, we will highlight the Egan's model, discuss implications for integration in counseling, demonstrate the use of counseling skills, and that will be done by the project assignment, and apply counseling skills in practice with real clients. The content that we are likely to go through is to have an introduction to counseling, the definition of key terms and related fields, the models of counseling practice, differences in skills training models, continue with the models of counseling, relationship and relationship creation in counseling, the relationship enhancement variables, the core conditions, implications for therapeutic counseling, the counseling skills from introduction, exploration skills, support skills, challenging skills, counseling process, exploration stage, understanding stage, and action stage, all the way to you getting to understand the whole process. And then realize that this is a very practical unit. You will be required to relate skills to practice. And as I have said, we will work with the Egan Skilled Helper model, the introduction, right from the beginning stage, the key aspects of these models, implication for integration in counseling, work with the current scenario, because you find a client right from stage one, you proceed with this client right from stage one all the way to the time you will be finishing up with the client or discharging him out. And we shall be running the right terms we use for every other stage. We'll also look at the preferred scenario. Where is the client? And where do they want to be? Because oftentimes we meet the client at a particular point of need, and then it is our work together with the clients to move them to their preferred scenario, the healthy scenario, the healing stage, so that they can be well. We'll also look at some of the action strategies, explore some of the possible strategies, and choose the best fit, and then come with a plan of action. And then we will be undertaking the practice of counseling, and especially in those key, or in that key exercise that I've given in the project. And at this juncture, I would want to emphasize the need for each one of us to really to be committed to this class, because we can only learn as much as you are willing to give to this class. We don't have the time, and therefore your participation is key. I will be recording a video for every week or even two, so that we are able to move. This should have come last week, but we thank God this one is coming in. But before probably Saturday, we'll also be doing another one so that we catch up. To begin off, in the practice of counseling, we would want to understand and outline the generic skills of counseling. Look at the core conditions, describe the process of counseling, and look at each of the goals of the Egan model of counseling, and from there move on to analyzing the map of the territory. I may not emphasize so much on some of the terminologies or the definitions, but the key ones, I'll continue mentioning them as we move. At the beginning, we all ask ourselves, what is counseling? Maybe take a pause and consider, what brought you to this class? What brought you to want to do this course? What is counseling per se? What drove you to want to do counseling? You have heard people out there probably saying counselors are mind readers. Some people have even described our profession as one of magicians. Exactly what is counseling? Counseling attempts to provide encouragement and guidance for those who are facing different forms of losses, decisions, or disappointments. Counseling can stimulate personality growth and development. Counseling in the hands of a profession, of a professional, help individuals going through life challenges to cope more effectively with the problems of living, with their inner conflict, and with crippling emotions. If you become that proficient counselor, you will be in a position to assist individuals, family members, married couples to resolve different forms of interpersonal tensions and to relate effectively with one another. We expect you to be that professional person who assists persons who are going through life patterns that are self-defeating and causing unhappiness. Clients come to help us or to psychologists, to counselors, because they are unhappy with one or more dimensions of their lives. Clients or people come for counseling because they feel incompetent. They have issues with coping skills. They feel unhappy. They feel not satisfied. They feel a tendency of wanting to give up with life. And therefore, they will seek you out when you become that professional person to assist them in their life journey. Why do clients seek help or counseling? Clients with problem situations, missed opportunities, or unused potential will seek help on their own motivation or be sent by others to seek help. And probably even as you listen to this, you may remember a time you felt so down. You felt you needed somebody to walk with you. As a young person, probably a girlfriend walked away on you, a boyfriend walked away on you. Probably you know what the society call failing an exam. In counseling, we have no failing. We only go through challenges. But society probably gave you or a friend of yours that label of having failed and you needed support. Many clients become clients because either in their own eyes or in the eye of others, they are involved in a problem situation they are not handling well. Others come because they feel they are not living as fully as they might, and many come because of a mixture of both. And missed opportunities, issues to do with coping, those feelings of I'm not adequate, and they will come looking for help. Therefore, oftentimes client problem situations or missed opportunities and unused potential constitute the starting points of the helping or the counseling process. Problem situations may be many, as stated, and oftentimes ours as therapists, ours as professional counselors, is to listen from the perspective of the client to hear exactly what these problem situations are. They can be messy, and oftentimes they include crises, different forms of troubles, doubts, difficulties, and frustrations and concerns. And all these are labeled as problems. But they are not problems like in a mathematical sense, because these problems often cause emotional turmoil and have no clear-cut solutions. And that's why we say clients come with problems, situations, that is, with complex and messy problems in living that they are not handling well. And the problem situations may be many. As we move on, we'll be hearing how often these are. It could be to do with your marriage life. It could be do with the challenges of coping with school. It could be the challenge of not making ends meet in economically hard times like the whole world is experiencing post COVID. All these could total up to be diverse problem situation. The issues of loss and grief, the issues of trauma, the issues of death and dying, the issues of chronic ailments or illnesses, all these could total up to the problem situations. And oftentimes, the clients will come. And for us, it is very important to note that the goal of helping is not to solve problems, but to help the troubled person manage them more effectively or even transcend them by taking advantage of new possibilities in life. Asking and helping the client reflect on how else could I handle this? Problems situation may include missed opportunities or unused opportunities. And it's our work to work with these clients and help them to unlock the unused potentials, to take advantage of the missed opportunities. Like for people who feel locked in dead-end jobs or dull marriages, how do we help them? They could be frustrated because they lack challenging goals. They could be feeling guilty because they are failing to live up to their own values and ideals. And they would want to do something constructive with their own lives. They could be disappointed because they feel as if though I am a failure. And part of counseling is working with them to help them realize their full opportunities and take advantage of the opportunities surrounding them in this life. The goals of counseling can be summed up into two broad areas. One, relating to clients managing specific problems in living more effectively or developing missed opportunities and unused resources. The other, relating to their general ability to manage problems and develop opportunities in everyday life. Both goals are related to increasing clients' happiness. And I want to emphasize goal one, helping clients manage their problems in living more effectively and also to develop unused resources and missed opportunities more fully. Goal number two is to help clients become better at helping themselves in their everyday lives. All of us want some form of improvement. And that's probably why you're in this class, because you needed this degree, because you wanted to climb a ladder up there, you wanted to move professionally, and that's probably why you're in this class. All of us want to move to a higher position. And therefore, part of your work as the professional counselor is to help this client become better and to learn how to exploit their opportunities. And the question is, are there good helpers and bad helpers? I may not emphasize much on this, but I would want to throw the challenge to you out there. As you move on, probably to answer that question, as in every profession, Definitely, there'll be good apples, there'll be the bad ones. So, are there good helpers and bad helpers? Yes, indeed, there's some evidence that therapy sometimes not only does it end up helping, but it can make things worse and can come out with negative outcomes. Some of the factors associated with negative outcomes in helping are associated with the clients who come before you, and others could be out of your own making, out your own disposition as the helper, out of a lack of professionalism. And we'll be looking at this as we move on. Therefore, challenges may come from two ends, from the client or from the therapist. Sometimes clients who have severe issues or symptoms, they may be poorly motivated. Some may expect, the whole process to be painless, may become dysfunctional through therapy. Because counseling is about, getting into the very depth of your being. Just like somebody goes to the doctor and they are required to undress, in therapy, the client psychologically may be required to undress. And I say psychologically, not the physical level. Get me right. Psychologically. They need to come out clean so that they are helped. And some are not willing to face the ghosts, the skeletons in their closets. And when you push them, then the outcomes may be negative. Then there are those helpers, there are those professional counselors, and here I use the word professional with some misgiving, because if the negative outcome is the end result, then we may question the use of the word professional. But let me say, there are those helpers who underestimate the severity of the client's problem, and they end experiencing interpersonal difficulties with clients. They may end up using poor techniques. They may overuse a technique. They may disagree with the clients of the helping methodology, and they can make things worse. You may have come across the terminology transference and countertransference. Transference is when a therapist has issues emanating from the client. In this situation, the client often may end up developing that form of dependence because of how they feel towards the therapist. Countertransference is when the therapist responds to this and acts on this kind of feelings or issues. And this could bring issues. I'll be talking about transference and countertransference as we move on. Some helpers, and I hope that you will not end up in this scenario, some helpers are also found to be incompetent. And even the competent and the committed may have their lapses once in a while. And to avoid this type of lapses, supervision is recommended from time to time. We look at the person of the counselor. The counselor is a therapeutic person. Because counseling is an intimate form of learning, it demands a practitioner who is willing to shed stereotypes, laws, and be a real person in a relationship. That real person. And especially when we use the word empathy, we mean a therapist who can conceptualize the world of the client, how this feels, how this impacts on the client. Like when a client is sharing about a particular loss, you project yourself in their shoes, you conceptualize their feelings, different from sympathy. Because sympathy is, oh, sorry, this must, have been tough for you. Sympathy is not the same as empathy. Empathy is, I hear you. Can I hear more? Yes, even as you say, this must have been hard for you. Can I hear more? This hurt you, and I hear this. And you want the feelings to come out. You get into the conceptual world of your client and identify with them. And this is a very challenging issue and area for all of us because we are healers. Within the context of a person-to-person relationship, the client experiences growth. We cannot afford to be technical experts and leave our own reaction, values, and self out of our work because the result is likely to be sterile. And that's why I keep on challenging us, especially at the beginning levels. Are you willing to be that person who carries this kind of pain and hear it from your client on a daily basis? Because it's not easy. It is like that doctor on the operating table and they have opened up this person and they can physically see all that which is affecting their patients. For us, we see psychologically, we hear psychologically, we share psychologically the pain and the issues of our clients. We'll be talking later on about how we deal with ourselves as we go through this. We are therefore called to be genuine and alive so that we can significantly touch our clients. If we make life-oriented choices, radiate a chest for life and are real, that is authentic and congruent. In our relationship with our clients, we inspire them to develop these internal resources. Our clients want to hear they are dealing with human beings who feel and hear and identify with their concern. Not with this professional person, this dry person out there. Next, what happened? Next. You are not a doctor doing a diagnosis. No. You are a helping person. You are a professional counselor who want to literally get into the world of their clients. This does not mean that we are self-actualized person who have made it or that we are without our problems. We are human beings. We have our concerns, we have our problems, but rather it implies that we are willing to look at our lives and make the changes we want because we affirm that changing is worth the risk and the effort. We hold out hope to our clients that they can become their own person and can like the person they are becoming. We are models for our clients. Therefore, we model incongruent behavior, low risk activity, and remain hidden. We can expect our clients to imitate this behavior. If we model illness by engaging in appropriate self-disclosure, and hear me carefully, when I talk about self-disclosure, I am using the word appropriate self-disclosure. A client is seated before you and they are sharing an instance. Let's say this already. They are sharing an instant in which they lost their husband through death. And you are here listening and you are identifying with them along the way. But then as they pause, you say, "Oh, I hear you. This must have hurt because I felt the way you are feeling because 5 years ago, I also lost my husband." And the client looks at you and it is like, "Are you for real? You can never feel the same way I felt because your husband is very different from mine." Both of them were death experiences, but they can never be similar. Appropriate self-disclosure is, "This must have hurt. Though I can never fully identify, though I can never fully hear or feel the same way you're feeling, 5 years ago I had the experience of losing my husband, and it really hurt. Even today, I am trying to recover. Your pain must be great." You affirm their pain by appropriately sharing what you went through, but never comparing it to the experience of the client because it can never be the same. Even in a family, when they lose a father or a mother or a brother, the experience of the loss is always different with every family member because this member means something different to each one of them. When we lost our father sometimes back, 8 of us in the family, we mourned differently because we attached different meanings and relationship and all the dynamics that comes with having a father differently. So it is never the same. Appropriate disclosure is, "I had an experience like this," but it can never equal yours. So I hear you because I felt pain. You must also be going through pain. I hear you. It's not about I understand you. You can never understand my pain, but I hear you. Appropriate self-disclosure is not when a client is sharing about having lost something and you tell them that is nothing. I also lost $1 million the other day and I'm here and I'm coping. So your 500,000 loss, you will get over it. That client may not come to your office the next time you're expecting them. Yes, both of you went the loss of money, but you minimized the loss of your client. Appropriate self-disclosure is sharing only about those parts of your story that can build your client and can help them share and even open up. To be sure, counseling can be for better or for worse. Clients can become more of what they are capable of becoming, or they can become less than they might be. And therefore, we come to that aspect of where we ask ourselves, Therefore, who or what are the characteristics of effective helpers and counselors? I will move a little bit fast because you can always read your notes. But I will look at a class of personal qualities and characteristics that have been identified as essential. Number one, effective counselors have an identity. Who are you? What are you capable of becoming? What do you want out of life and what is essential? An identity. Because if you don't know where you're going, for heaven's sake, get out of this crash and first and foremost, find yourself. Because if you're lost, you can never find the way together with your clients. Number two, they respect and appreciate themselves. They can give help and love out of their own sense of self-worth and strength. An appreciation for the self. Somebody with self-worth, so that they can transmit the same to their clients. They are able to recognize, this is number three, they are able to recognize and accept their own power. Like a principal, like a head teacher, like a senior police officer, you hold a lot of power over your clients, and this power should never be abused. You must feel adequate with others and allow others to feel powerful with yourself. A counselor at number four must be open to change. We live in a dynamic world, and especially for us in our contemporary world, we live in a multicultural world in which we are coming across different cultural beliefs, different religious beliefs, different paradigms, different, setups. And therefore, we must be open to change. We cannot be this rigid person who doesn't welcome any form of change. A counselor must be willing to show a willingness and courage to leave the security of the known, even as they work with their clients, sometimes in the very depth of the unknown. They make decisions about how to change, and they work toward becoming the person they would like to become. Number five, or the other point, they are always making choices that shape their lives. A counselor must be aware of the other decisions they made about themselves, others, and the world, and often reflecting on them and asking, how else can I change here? A counselor feels alive to the moment, and their choices are life-oriented. Committed to living fully rather than settling for mere existence. A counselor is authentic, sincere, and honest. A counselor must have a sense of humor. Life is about having a smile. Life is about fun. Don't be this rigid person who is always looking like at the world as if though the world is coming to an end in the next moment. Enjoy life once in a while. Watch that movie. Enjoy those TikTok clips. Get on the WhatsApp and share some jokes with your colleagues. They're able to put the events of life in perspective. They have not forgotten how to enjoy real laughter from the very depth, at their own foibles and contradictions. We do make mistakes. We laugh about them and we move on. Counselors make mistakes and are willing to admit them. Counselors generally live in the present. Counselors appreciate the influence of culture. And for this, we need to be very key because we live in a very cultural world, yet dynamic one. Counselors become deeply involved in their work and derive meaning from it. To be a counselor is fulfilling. It opens opportunities and doors for you, some of them you can never imagine. Counselors are able to maintain healthy boundaries. Earlier on, I talked about some of the challenges we go through. And to overcome some of these challenges, personal counseling is indicated for the counselor. You know, the discussion of the counselor as a therapeutic person raises another issue debated in counsel education, whether people should be required to participate in counseling or therapy before they become practitioners. And to become a good practitioner, you must be trained. You must go through personal counseling. And personal therapy is very instrumental in healing the healer. You know, we see a doctor out there can go to the doctor's room and prescribe and do all that appertains to his profession, even when he's not okay. You know, he can be sick, but he can be treating and helping others to be okay. But a counselor, unfortunately, may be affected if he's giving services and he's not okay. A counselor must be well first, and this wellness is obtained through supervision, is obtained through personal therapy. And therefore, it is very instrumental in healing the healer. As counselors, we can take our clients no further than we have been willing to go in our own lives. If student counselors are not actively involved in the pursuit of healing their own psychological wounds, they will probably have considerable difficulty entering the world of a client. For example, let's take a situation in which somebody has gone through a very recent divorce and they are so bitter, either against their husband, their ex-husband, or their ex-wife. And this person who is so bitter with an ex-husband, the client who comes in is a husband looking for a way out of a troubled marriage. There will be a lot of transference issues and counter-transference issues. Probably this lady wondering, such a lovely man and somebody wants to walk out on her. And then this man will be responding like, oh, this is a very caring woman. And before you know, this may proceed on to some other level. Because both of them are hurting and they have found each other in therapy out of their woods. If the counselor is not helped to go for personal therapy or to have supervision, the issues of countertransference may be too much for her to handle or for him to handle. If we are not committed personally to the value of struggling, we will not convince clients that they should pay the price of their struggle. Through being clients ourselves, we have an experiential frame of reference to view ourselves and the struggles we have gone through. This provides a basis for compassion for our clients. I have been there. I have suffered in this way. I got help in this way. And therefore, as this person talks about their experiences, you are not judgmental. You are hearing them with a professional ears. For example, you could be a Christian counselor like I am. I'm a professional counselor, yet my orientation is Christian. And somebody is coming, talking about how they have been having, a number two somewhere. And instead of hearing them, you start condemning them. You start talking of sin. You start talking of how they are judged. But for a counselor who went for therapy with the same issues and were helped, or even not with the same issues, but they were helped to deal with issues like this, they will listen with the counselor's ear and avoid being judgmental. Because being human predisposes all of us to the likelihood of failing once in a while. So being human helps us to hear the other human beings in their unique struggles. Our own therapy can help us develop patience with our patients. We learn what it feels like to deal with anxieties that are aroused by self-disclosure and self-exploration. We may experience transference and thus know firsthand how it feels to view our therapist as a parent figure. Being willing to participate in a process of self-exploration can reduce the chances of assuming an attitude of arrogance or being convinced that we have arrived as a person. Indeed, experiencing counseling as a client is very different from merely reading about the counseling process. Yalom, writing in 2003, strongly recommends that trainees engage in their own personal therapy. And that's why a requirement of this course, this unit, is for you to go for personal therapy. And before you graduate, we will need the personal therapy hours from you as part of the requirement for this course. Yalom contends that it is most important part of psychology and psychotherapy training, the aspect of personal therapy. He argues, based on the assumption that the therapist's most valuable instrument is his or her own self. If you're not okay with yourself, you cannot help others to be okay. The main reason for having students in training receive some form of psychotherapy is to help them learn to deal with countertransference. You know, the process of seeing themselves in their clients, of over-identifying with their clients, or of meeting their needs through their clients. Hear this. Countertransference is when you as a therapist, you see yourself in your client. You have identified with your client, or you want to meet your own need through your client. We need to recognize the manifestation of our countertransferences and acknowledge that these reactions and dealing with them is one of the most essential abilities of effective counselors. To recognize them, to deal with them, is one of the most essential abilities of effective counselors. Unless we are aware of our own conflicts, needs, assets, and liabilities, we cannot be effective in therapy and we'll have challenges. We cannot be available fully for our clients. If we are unaware, we may be carried away by the client's emotional tidal wave, and therefore we stop being of help to them. But being aware of these reactions help us to deal with the feelings that can come in during our own therapy and supervision. Ladies and gentlemen, as you listen to this, let me say that the counselor also must have values and be careful about these values in the therapeutic process. And therefore, self-exploration is very, very important for counselors so that their values don't affect their work and doesn't carry over to the client And values include even the beliefs they hold. Values in counseling is about asking the question, how far should they enter into a therapeutic relationship? A Christian imposing their Christian values on the client. A Muslim therapist involving or imposing their values on their client. And this can be a problem. We are not value free, but the critical concern is we are in a professional relationship. And therefore, awareness of our values help us to be careful that we don't impose them on the clients. Well, as we move on, let me say about what counseling is not. And I'll be very brief here so that you can also read in your manuals. Counseling is not a conversation. It is not a discussion. Counseling is not an interrogation in which we are asking questions like within the security forces. Who are you? Where are you coming from? Why are you dressed in green? Why are you walking in the night at this hour of the night? No. Counseling is not an interrogation. The client is not being questioned in order to find out the truth. We are doing exploration. Counseling is not a discourse by the interviewer. The interviewer does not use counseling in which to listen to himself speak or hear his own opinions. Counseling is not like the conversion we go to do in church. The the client is not being morally evaluated, pardoned, or absolved by the counselor. They are there for healing. They are there to understand themselves. Counseling is not a search for diagnosis. Counseling is not giving information just for the sake of information. It is not about giving advice. It is not about influencing attitudes, beliefs, or behaviors. The client should not be persuaded, compelled, or threatened to change his attitudes to those of the counselor. Remember, you model behavior so that the client, in the course of the therapeutic alliance, may learn from you, but you don't persuade, compel, or threaten change. In every other counseling encounter, there are some expected outcomes. A person who goes through the counseling encounter may gain some of the following: being more competent, being more contented with life, learning to be more creative, gaining at the personal growth level. Counseling instills hope. Counseling boosts self-esteem. Counseling leads to behavior change. Counseling leads to self-understanding. And this must necessarily be part of why we want or aim to get into counseling. Ladies and gentlemen, I'll be requesting you to read further and look at the differences between guidance and counseling and make short notes on that. I talked about how a competent counselor is expected to be, but I want to further emphasize on some areas or on some of the qualities of an effective, competent counselor. Number one, a competent counselor is required to be a person of empathy. Empathy refers to the ability to tune to another person's situation with intention to assist this person. The counselor needs to be able to communicate to the other person about the same understanding while avoiding to become or to be overcome by sympathy. I talked about conceptualizing the world of your client and entering that client world at the conceptualization level and hearing them from their own perspective. It is like entering into the world of a person while taking care not to be entangled with the person's issue. Through empathy, a counselor is able to identify with the client without taking the praise of the client or feeling sorry for them. Some other quality expected is respect and warmth. Genuine respect. A client is free to come as they are. Allow me to borrow from the Bible. Christ says, "Come to me, all you are heavily laden, and I'll give you rest." He realizes that we are carrying all forms of burdens. He doesn't tell us to, throw them out on the way as we come to him. He says, "Come as you are." A client is free to come to you with their sexual immoralities, with their drugs problems, with their brokenness from their relationship, broken as they are. And when they come to you, they expect not to be judged. A counselor is also required to be genuine. An effective counselor is open to oneself and to others. Genuineness involves a high level of honesty and not pretending to be what or who one is not. When a counselor is genuine, the client also becomes open in the counseling relationship. A good counselor does not wear a mask, and I'm not talking about the mask we have been using for COVID-19. I'm saying about blocking their being. A counselor doesn't display a facade. He comes open or she comes open. A counselor must be culturally sensitive. Don't be judgmental about other people's culture. Remember this. In my culture, maybe it's okay to eat snakes. In your culture, that probably could be an abomination. But the critical thing is that, to me, that is food. To you, that's not okay. But in your culture, you also eat probably fish. And in my culture, how can somebody eat something from the water stream like that? At the end of the day, all this is food. Respect that. To be sensitive to the cultural background of the client. Be careful about, like in the African environment, we don't just go hugging or touching just like that. Maintain professional boundaries. A counselor must have the quality of maintaining confidentiality. Confidentiality is a key issue in the counseling relationship and needs to be safeguarded unless in very special circumstances. And if this confidentiality has to be broken, you must make the client aware right at the beginning about the limits of confidentiality. A counselor must be a person of integrity. A counselor must be a person who is a good listener. We say listening with the physical ears and listening with the that ear that comes right from inside the person so that you can develop empathy. A counselor must be self-aware. A good counselor needs to have self-understanding, including about his or her own weaknesses and strength, body image, ambitions, visions, and aspirations. A counselor without self-understanding is not likely to help others to understand themselves or to have self-appreciation. A counselor must be professionally competent, and that is part of why you are in this class, and it is our hope that we shall help you in this professional journey. A counselor must be a creative person, and like I said earlier, a person of humor. All forms of counseling require a lot of creativity because people are unique, problem situations are unique, environments are unique, with varied issues that require varied options and exploration strategies. Hence, a counselor does not use a common manual in counseling people, even when people make similar presentation of issues. You listen to every other client, every problem situation as a unique client, as a unique problem situation. A counselor must be in good psychological health. A competent counselor has to be in good mental health and with the ability to manage one's own stressors in lives. If you can't manage yourself, how are you going to manage those others? A good counselor also needs to have good emotional management strategies. For example, how do you deal with anger and guilt issues? A counselor needs to avoid habits and practices that can interfere with good physical and mental health. For example, drug and alcohol abuse. A person who suffers mental disorders may need help first before moving on with counseling. Ladies and gentlemen, please continue reflecting on that before I post the next video for the next class. And kindly read on the notes, read the manual, so that if there is any question, please let us interact on the WhatsApp, on my email, and on the university portal, so that we can continue learning together. I hope you are catching up with the assignments, and in case of anything, please don't hesitate to contact me. You all have my number. You all have my email posted on portal. Welcome. I hope you enjoyed this first interaction. We shall continue having many others. Thank you and welcome.